Hi, welcome to my video entitled Spinal Decompression Explained. My name is Dr. Joel Rosen, and I'm really excited that you're watching this video today because it means that you're looking for some more information about potentially your own back pain, someone you know, a loved one, or anyone, just more information on lower back pain. And you've heard about spinal decompression, maybe someone you know has done it, and you're looking to do it yourself, or you want one of your loved ones to do it, and this is the place that you've come to find. So I'm really excited. I got some awesome information for you. I've been using spinal decompression in my office for about 8 to 10 years now. I would definitely tell you that I don't think there's anyone out there that knows it more than I do, maybe as much as I do, but I feel like I have some real hands-on experience with this machine. I've been everything from the sort of the head cook and bottle washer, from setting people up to taking them off, to qualifying them, to explaining how it works, to going to the manufacturers, to understanding how it works, to marketing the machine. I just know the ins and outs, and I wanted to produce this video today for you so that I can provide you with some awesome information. So, some important information. What I want you to do is, if it is for you, then take some notes down. And if you have any questions, I'm going to urge you to come on in or call me. I'll give you the information at the end of this video that you can call me and ask me questions, or research the statements that I say to see that they're true or not. I want you to watch this video all the way through and just get an idea as to what I'm trying to tell you, and really hopefully it's going to give you some awesome information. So let's first talk about neck and back pain options. In my office, I actually have the spinal decompression combo unit, which means it's going to take pressure off the neck if you have compressive discs, carpal tunnel, numbness, tingling, any type of pain down the arm. It's going to, even headache pain, believe it or not, it's going to help you. So we have the cervical spine unit, and we also have the lumbar spine unit, and that again is for stenosis, disc degenerative disease, osteoarthritis, same thing, any type of sciatica pain, facet pain, even spondylolisthesis pain. And believe it or not, I've even had patients that have had surgery in the past, and there's a couple considerations that we use for them, but we've done awesome therapy with them as well. So what are your options? The first option potentially is surgery. And the majority of my patients, probably along with you, this is the last option that you're looking for. And that makes sense. Every now and then I'll have a patient who, no matter what I do, they're a surgical candidate. They've been suffering, they can't get out of bed, they have numbness tingling down their legs such that they have a foot drop or a heel drop, and they can't function. I mean, certainly if you have any type of saddle paresthesia, meaning if you're riding a horse and where the saddle would go, that's numb or tingling, that's a surgical emergency almost right away. But ultimately, surgery is the last option that you or your loved one wants to do, and this is what you're looking for, some other alternatives. So pain management also includes epidural injections. You know what? Epidural injections, they are helpful if you have the right problem for it to help you. What I mean by that is studies show for epidural injections, if you have numbness or tingling that radiates down the leg, then the epidural is potentially going to help you. Now, I get a lot of patients that have epidurals in the past, and they said it did great for me, but now it doesn't do anything. It may have lasted for 2 years, doc, and now it only lasts for 5 minutes. Doesn't give me very much relief. So unfortunately, that does happen, and the older and older we get, and the more injections you have, the more provocative the ill effects can be. So there's only a limited life in that, and you know as much as I do, it's really not going to try to help correct any of the pathology or the breakdown that's incurred in your back. It's numbing the area, it's creating lack of inflammation, it's almost shutting off the water valve. The way I explain it is, remember when the Gulf Coast had the broken pipe and it was spewing out, and you saw it spewing out? That's sort of like an inflamed disc. And when you do an epidural, you turn off the pressure so that you diminish the amount of spewing out on that area. And that will give you some relief, but it doesn't do anything for the pathology. It doesn't fix the pipe, it just slows down the damage. We also have nerve blocks, facet blocks, rhizotomies. These are all, again, ways to try to inhibit your pain and make it so that your brain is not aware that the pain is there, even though it still is there. Nothing's changed, and I'm sure you've gone down that road before, and yet you're watching this video. So pain management, we have anti-inflammatories, muscle relaxers, analgesics, antidepressant. I mean, what is that? I mean, here you are suffering because you have a lot of pain. The doctor hasn't been able to help you. And so we've done all we can, and we've looked, and you shouldn't really be in that much pain. So you know what? We're going to give you an antidepressant. That's because it's your problem, not ours, and we're just going to try to make you feel better. And to me, that's ridiculous. As well as mood disorders. Even what about this? Let's do like an anti-seizure medication. Even though it's not really for your back, we found that people that had seizures complained of less pain. So we're going to redesign that drug, put a new fancy packaging and color on it, and have someone running through the field in the commercial, feeling great, and you got to do that medication too. And you're sick and tired of that. Besides which, it's not healthy for your liver and your kidneys. I'm sure you don't. I have a lot of people coming with blood tests, and they have liver and kidney enzyme levels that are high or low, and we find that they've been on anti-inflammatories or medication for a long time. Other things we can do is physical therapy. Now, physical therapy is an awesome thing to do. You need to get out there and move your body and get some oxygen delivered to your muscles, get your happy peptide chemicals kicking. It's great, but unfortunately, it doesn't help a lot of patients that have degenerative disease because it's not taking pressure off the disc. It's making your muscles stronger and more flexible and more conditioned, but it's not taking that pressure off the disc that you're getting your pain with. Or it is getting pressure off the disc, but it hurts and you're worse. I have a lot of patients that have done that and they're worse, and so they're coming to see me. Conservative management, chiropractic. Chiropractic is certainly something that a lot of people do, and they've had some good results, they've had no results, or unfortunately they've had some bad results. I get a lot of patients that come into my office and they don't want anything to do with chiropractic, they just want to do the decompression, and that's fine because they do awesome. So chiropractic is an option that a lot of people can try and may not get the results they're looking for. This would be great if we had this one just laying on the beach and hoping that everything goes away, but unfortunately, if you're looking at this video, you've probably suffered for a long time and that hasn't worked. So we got to find a new solution. And that solution is spinal decompression. So let's talk about non-surgical spinal decompression. What does the actual spinal decompression DRX 9000 do? The best way I can explain this is think about your spine like almost like a slinky. And when that slinky gets old and rusty, when you drop it down, those coils don't necessarily open up very well. You'll have like 3 coils that are stuck, and then 2 coils go down, and then 1 coil stuck. That's kind of what happens in your spine in a crude type of way. When that happens, then you have too much pressure in between those coils. Another way of looking at it is stepping on a jelly donut. When you step on a jelly donut, the jelly can squish towards the back, to the side, and cause pain around those fibers. Almost like, again, stepping on a balloon. And when you step on that balloon, the nerve fibers get distended and it causes pain. So what the decompression does is it actually opens up those areas in a very gentle, non-forceful, very, very palliative way, or a very pain-relieving way. And that will give you some, number 1, relief. And number 2, it will take the pressure off the discs. And that's really important because it's not so much the disc material comes back in, which it potentially can come back in, but what happens is it actually infuses that disc with fluid, with oxygen and nutrients to help that fluid grow. Like I'm watering a plant. That plant gets dehydrated, I put fluid in there, and it starts helping it grow. The analogy I use is think about a herniation like a syringe. If I'm giving you a shot, like a medicine shot, then there's pressure in that cylinder that's more greater than the pressure on the outside, so it pushes that fluid out. That's like your herniated discs. When you pull back on the plunger, that's like dropping the pressure inside that cylinder and sucking up that medication. That's what the decompression does. It slowly takes up to half your body weight off in your lower back. So if you weigh 200, it's taking 100 pounds, up to 100 pounds or more, up to 110. Or in your neck, if you weigh 200 pounds, you can take up to 20 pounds, so 10%. And what that will do is that will drop the pressure in the disc, like we pulled back on the plunger, and allow fluid to get into that disc. And that fluid now will help hydrate the disc and rebuild the disc. A lot of my patients will ask me, well, how is it going to stay? Is this going to last forever? And I explained nothing lasts forever, but What it does do is it will rebuild that disc, allow that disc to get fluid and nutrients and be more healthy, and not be continually telling your brain that there's pain. So that's what it basically does. And what does this do biomechanically, or actually biochemically? It speeds up tissue repair. So if I water a plant, it's actually allowing that vitality to come back to that plant. It reduces scar tissue. A lot of people go on the table that have had surgeries that have contractures and scar tissue, and basically it's breaking up that scar tissue slowly, surely, till eventually the muscle can try to regain its normal length. It also increases oxygen supply, decreases pain, and reduces inflammation. So, is there any side effects to decompression? That's a great question. Well, first of all, it's FDA cleared. And potentially, if you lifted a box and you couldn't straighten up, and I put you on there right after that, you're going to get inflammation, spasm, and pain. So I wouldn't put you on there if that were the case. The big three that we rule out if you've had a spinal decompression consultation or you're considering it basically we say, well, there's 3 reasons to not go on there. Number 1 is a aortic aneurysm, dissecting aortic aneurysm. So on an MRI, you will have a radiologist that will talk about the aortic aneurysm, or aorta for that matter, branches off the heart and comes down in front of the bones. And if they see a bulging or outpouching, that may be causing your lower back pain. More of those people don't come in my office because they're surgical candidates. They may need to go get that reinforced, and they're not coming here. I've had a couple of them come in here and absolutely no to the machine. Number 2 is what's considered a spondylolisthesis. I've had grade 2 spondylolisthesis. Basically what happens in that case is you have a bone here, I'm looking at you from the side, and another bone here. If the bones are not in line, then it's called a slippage forward. If it slips greater than half the distance of the bone underneath it, it's considered a grade 2 or greater. And the protocol for the machine is you don't typically put patients that are greater than grade 3 on there. And I haven't had anyone that actually ever came in with a grade 3, but I've had a grade 2, and I had to change the parameters and go very light. And to be honest with you, those are the patients that, in my opinion, they do the best with my machine. So grade 3 or greater, I don't put them on. And then lastly is any hardware. So fusions, rods, screws, plates, the pumps. You can put a patient on there with a pump that doesn't necessarily have a pain pump, that doesn't necessarily have a fusion. Bilateral hip replacements I've put on there, bilateral knee, or one near or both knees I've put on there. Cervical spine fusion, I've put lower back patients on there. So you have to use some discretion. Some doctors around the country put people that have hardware on there. Instead of going half the body weight plus or minus 10, you start at about 25 pounds, very light. And those patients do very well as well. There's also post-treatment recommendations. So you said, is it safe or can it hurt? If you go and you try to move the groceries after, or lift the groceries out of the car after a treatment, my suggestion is the first 4 to 6 hours after treatment, try not to do too much. Just try to put ice on there and avoid any major activity. Other neck pain options that we talked about is a machine like this. Some relief I'm sure you can do with that, but there's some difference in the technology on angulating the area. There's the curvature of the pulling. If you can do that, fine, but we just sort of have the Cadillac of decompression machines. And here I have a couple of testimonials of patients that have gone through my machine, and I want you to look at that and see what they have to say, and then I'll be right back.
Well, the reason I came here was because I was having tremendous pain in my neck. I have 4 bulging discs in my neck, and my pain levels were at least 7 to 8 at any given time. Made it very hard to function, made it very hard to work. I went through plenty of jobs where I couldn't work, and just decided that it was time to start taking care of myself, and came to the doctor and met them through a work contact, and I came in and figured, let's just try it, see what happens. It couldn't hurt because I'm in so much pain that it's probably to the point where it's not going to hurt anything. So I came in and I did a treatment, and my first treatment I was pretty sore, but I came back a couple days later and there was no pain after that, and I've had 6 treatments since over about a 30 to 45 day period, and I'm completely off my pain medication. I have I have very minimal pain, a 1 to 2 on a scale of 10, and I feel better. I've got my pH levels back in line like the doctor wanted me to, and started doing some exercise programs, and I feel like I'm 30 years old again. So it's been a real good experience for me, and I'm very happy, and I'd recommend it to anybody coming in that has pain before you decide to go do surgery. It's been a great experience for me, and I'd recommend it to anyone.
Hi, I came to the clinic here for a herniated disc for the L3, 4, and 5, and I was put on the DRX 9000, and since I've been coming, it's my 12th session, and the massive improvement. I know that in a couple of more sessions I should be able to feel myself again, and I am thankful for that.
My name is Ruben Browner, and I came to Dr. Rosen because I have a bad lower back. I actually have an extruded L4, L5 disc, and for years I've been going and getting epidurals done with varying degrees of success and non-success. I've actually had 8 epidurals, and they only lasted for about 6 months to a year each. And then I heard about Dr. Rosen through a group that I belong to, and I came to see him. And I was somewhat skeptical about the DRX 9000, but after the first 2 weeks, my back was amazingly better. I mean, I was in pain probably 90% of the time until I started using the machine, and now maybe I'm in pain 5% of the time. It really has been almost miraculous. So I could not recommend the DRX 9000 and Dr. Rosen any higher.
I've had problems with my lower back, pains in the cheeks of my butt, and I had been going to another chiropractor, and half the times I would leave his office I felt worse than when I went in. And I was out to dinner with a good friend of mine, and he recommended Dr. Rosen, mentioned about his machine, and it sounded very appealing to me. So I made an appointment, came to the office, and found the office to be very professional, very knowledgeable, extremely accommodating. Took detail, explained to me how the machine works and how it would help my back. And I started a series of treatments. And I have to say, after 9 treatments, my back is pretty much like 95% healed. And now I come back for, just to finish up a few more treatments. I'm a racquetball player. I walk, I exercise, I bike ride, and boy, my back is nice and free again. And all I can say is that they're terrific. They perform better than what they said, and I'm very, very happy.
So I hope you found this information valuable. And if you continue watching this video, I have an offer at the end of this video that you can click that will allow me to determine if you're a good candidate for my machine. Not everyone is. We get anywhere between 20 to 30 consults a month, and we can't accept everyone. We take about 10 to 12 new patients each month. Some patients just don't have a serious enough condition to do the machine, and I have to approve the patients that are the most severe. And some of the contraindications are there. You're not a good candidate based on some of the reasons why I wouldn't put you on the table. So I hope you found it valuable, and I look forward to seeing you soon. Thanks. Bye.